Okay, this is our last sound check before we get started. I'm going to go ahead and if you haven't taken the polls on the bottom of the screen there, go ahead and do that. I'm getting ready to broadcast the results of those polls. Looks like just about everybody has.
This is Jan Ulrich. Look forward to spending the next hour with all of you guys, and appreciate your interest and being willing to learn some of this warning signs and behavioral clues that someone might be in a suicidal crisis, and some things that can be done to help somebody when they're in a crisis.
Okay, and I'm going to go ahead and close those polls. So it looks like the vast majority of you, which was a surprise to me, have not had any suicide prevention training. So this is really great that we're having this opportunity today. And the majority of you have been personally touched by a suicide.
So this is Jan, and I just want you to know that if you have personally been touched by suicide, we're going to be talking about warning signs, behavioral clues. We're going to be talking about things that you can do. But if you've personally been touched by suicide, this might be a difficult thing for you to be listening to today. So certainly understand that if you need to step away and come back, and just take time for self-care, because that's an extremely important thing to do. But I'm just really glad that you guys have chosen to reach out and take part in this webinar.
Mm-hmm. Okay, we're going to do a couple of housekeeping things, and then I'm going to turn the presentation back over to Jan. So welcome everybody. My name is Charlie Taylor from KDLA, one of the CE consultants here. So just a few housekeeping things. First of all, as you probably already know, you will be receiving a certificate of training or of attendance at the end of today's training. You'll also be receiving a link to a survey about this training, and we'd appreciate just a quick response to that. We do look at those very closely and use them to influence our training decisions. So you'll also have an opportunity to download your own copy of these slides. The handout that I sent out earlier today was the notes version of the slides, so you have that already, but you can have the full size that you can refer back to or share with your colleagues, whatever you'd like to do with them. So we'll be doing that at the end of the presentation. If you have any questions, comments, technical issues, please feel free to go ahead and chat those in. We are going to try and keep up with questions as we go along. Unless it's like a complicated topic, then we might wait until the end to address it. So go ahead and feel free to use that chat box. So I think the sound is good. Everything looks good. So I'm going to turn it over to you, Jan.
Thank you, Charlie. Mm-hmm. So what does suicide look like in Kentucky? Well, Kentucky's suicide death rate is always consistently higher than the national average. And in the most recent state-by-state comparison, Kentucky ranks 18th highest in suicide deaths in 2014. And there were 727 documented suicide deaths. We know that many suicide deaths do go unreported, or they may get reported as accidental firearms, accidental overdose, accidental drownings. A lot of different accidental deaths may in fact be suicide deaths related. So we know that even that number, having the 18th highest, really probably isn't giving us the full picture. In Kentucky, about 65% of deaths by suicide are caused by firearms. And suicide is the second leading cause of death for our youth and young adults. Our elderly do have a higher suicide rate, and for many years our elderly were the highest at-risk population, but over the past 6 or 7 years that's begun to shift nationally and in Kentucky as well. So our highest at risk are actually our middle-aged males. But we do know that with help comes hope, because experts do believe that suicide is very preventable. We're going to talk about some risk factors for suicide. What are risk factors? Risk factors are not the same thing as warning signs. Risk factors may be factors that are characteristics that may mean somebody might be at an increased risk of considering, attempting, or even dying by suicide. We'll address risk factors first, but we will talk about warning signs in just a few minutes. So mental health disorders, mood disorders like bipolar disorder or depression, anxiety disorders, substance use disorders, all can be an increase of risk for suicide. If someone's gone through trauma, whether it's in early childhood or later on, or going through or have been abused, they can be at a higher risk for suicide. Certain types of physical illnesses can increase that risk for suicide as well. I talked a little bit about the substance use disorders. A really high percentage of people who die by suicide have some sort of alcohol content uh, if they are actually able to go back and measure that. You may see somebody that is very impulsive, and so maybe they take more chances or do things that are riskier, and that can actually put people at a higher risk. One of the biggest predictors is going to be that they've made a previous suicide attempt. And the issue of hopelessness. Hopelessness is a very, very common trait found in someone who is thinking about suicide. They feel as if that nothing's ever going to change. Their pain is always going to stay the same, and that they may not have any way of changing their situation. Some other risk factors may be if there is a family history of suicide. That can increase the risk for the whole family. We see a lot of the issue of joblessness or financial loss, and we believe that that may be some of the cause for the increased risk in our middle-aged males. It may be around joblessness or financial loss. A loss of a relationship, it could be a marriage, it could be a boyfriend-girlfriend situation, could be a loss of a relationship with a close friend. Easy access to lethal means, and by lethal means we mean firearms or pills that could cause death, other types of lethal means. There's just a short window of time when most people are acutely suicidal. They may be having suicidal thoughts for quite a while, but there are certain things that come together when someone is at a point that they could do it right now. And having that easy access to lethal means can be the difference between life and death. Local clusters of suicide, we see this a lot more with our youth, where a suicide death may happen in a school or a school district, and then we may see another one to follow, and sometimes even others after that. So it's really crucial when those things occur, clusters or contagion of suicide, that we step in to do what we call postvention, coming in to do some aftercare to try to help prevent another one from happening. Lack of social support and sense of isolation. And the flip side of that is connectedness and community can be a protective factor. And stigma about asking for help. And that stigma is very, very powerful. If we believe that people are going to look down on us, if we believe that, say in our occupation, we're afraid if we ask for help, we might lose our job, etc., then that can keep people from reaching out to ask for help when they might otherwise consider doing so. Some other risk factors can be lack of health care, and in particular, if it's mental health care and substance abuse treatment. And so we see in Kentucky and in all across the United States, in areas that there is less access to health care or behavioral health care, then we do see higher suicide rates. There are some cultures and religious beliefs that do condone suicide, that believe that suicide is a noble result of this personal dilemma that we go through. And believing that this is an okay thing can also increase that risk. And we talked about exposure if you've lost somebody or if somebody in a school, but it's not just confined to our students. We've seen an increased number of suicide deaths when we have a lot of media around a very popular figure that may have died by suicide. There was a lot that came out after Robin Williams died, where we saw some increase in suicide. And certainly on the flip side, we also saw an increase in help seeking, which that part can be a good thing. There are also protective factors for suicide. These don't necessarily mean that you're 100% protected if you have these particular things and that there's no chance that you'll die by suicide. But having certain protective factors can at least begin to lower that risk somewhat. And definitely having that access to clinical care for behavioral health disorders, which would be mental disorders and substance abuse disorders, and even physical disorders, especially in areas where there's someone is dealing with a lot of very chronic pain for a long period of time. Having that easy access to different types of clinical interventions to really fit the need of what a particular person may have. And again, I talked about how easy access to lethal means can increase the risk of suicide. At the same time, being able to restrict that access, not having something so easily accessible during that window of opportunity when somebody is at a point that they could consider suicide. And then that connectedness, that strong sense of community, strong sense of family, feeling like you've got somebody to turn to and you're not in this world by yourself. Some other protective factors can be having that support from maybe a physician, maybe a counselor. Those relationships can be extremely important. And there are ways that people can sort of shore up their own protective factors by maybe taking classes or seeking counseling help in problem solving, conflict resolution, and handling things in a nonviolent way. We also know that if our beliefs and our cultural beliefs and religious beliefs discourage suicide and support staying alive, then that can be a protective factor for suicide. So warning signs, what are warning signs? Well, warning signs are signs that people might be thinking about suicide right now. And they might be at some level of risk, whether it's an early risk or whether they've gotten to a point where they've decided they're going to do it and here's how they're going to do it, etc. So some of the warning signs can be that they're talking about suicide. They're talking about wanting to kill themselves. It's a myth that people that talk about it are only trying to get attention and that they're not really at risk. In fact, many people that do go on to die by suicide actually told somebody either directly or maybe in a text or on Facebook. So we have to take those communications very seriously. When someone is at that point, they may also begin to look for ways to kill themselves. So you might find after somebody has taken their life, you might find that they have researched various different ways of dying by suicide. Or maybe they've stockpiled pills, or maybe they've gone to buy a firearm. We talked about that element of hopelessness, feeling like you have no reason to live, that nothing's going to ever change, and feeling trapped in that unbearable pain. Most people really don't want to die. They just want the pain to stop, and they can't figure out how to make the pain to stop in the particular area that they're at right at that time. Somebody may be talking about being a burden to others. We see this in our elderly quite a bit, where they feel like because maybe they can't take care of themselves as well, maybe they're not driving, maybe there's physical issues, maybe there's some dementia, etc., and the feeling that my family would be better off without me because I'm a burden to them. Some other warning signs are that increasing use of alcohol or drugs. We often see someone, on one hand, we may see somebody that's sleeping a lot or sleeping too little. We may see somebody that's crying and very sad, and you physically interpret the depression that they may be feeling. But for some people, it may come out differently. It may come out in aggressiveness or extreme anxiety and being very, very reckless. Some people will withdraw, and they'll actually push away from the very people who might be able to help them get the help that they need. If somebody is talking about seeking revenge or just very extremely agitated and showing rage, that can be a warning sign for suicide. And then those extreme mood swings can also be an indication. Here's some of the ways that people in a suicidal crisis may feel. They feel like the pain won't stop, they can't think clearly, can't make decisions, can't see any other way out. All of these different areas can indicate that somebody is either considering suicide or on a path towards that situation. And it's almost like they have blinders on, and those blinders keep them from being able to um, really get a good handle on some of the good options that they may have to actually stay alive. So, what are some ways that you can help a friend or family member or coworker or teammate? One of the most important things to be able to do is to ask somebody directly, are you thinking about suicide? Be willing to listen. It doesn't necessarily happen quickly because you're going to want to take in and hear where they're at. Don't be judgmental. Um, they're probably judging themselves pretty harshly at this particular point, so you don't want to express it that way. But let them express how they feel. If you're able to get involved, show that you're interested and you're there to support, then those can be extremely helpful. And then checking in with a friend that you're really worried about. Don't act shocked. If you act shocked or if you act like you're very angry or upset over this, and then they're either not going to tell you that they are actually having those thoughts, or they're not going to believe that you actually will be able to help them, or they may feel like they're being judged, and so they may turn away and push away from you. Be patient with yourself. If someone says you can't tell anybody else, don't be sworn to secrecy. This is the kind of secret that we don't want to keep. We encourage in the school systems when they do their trainings, the mandated trainings for suicide prevention with their students, then they encourage students not to keep a deadly secret. Seek support. You don't have to be in it on your own. So you may ask that person, who else do you trust? Who else can we bring into this picture to be able to tighten that safety net? Help to offer hope, but not the type of hope of, oh, there's other fish in the sea, or things that make it sound like you don't recognize the pain that they're in. So helping them to see that things may not be hopeless, or there might be some other solutions without making them feel like you're really not listening to them. Taking action, and if it's safe for you to do so, if you can remove any sort of lethal means, if you can get a firearm out, this is not a forever thing. This is not a taking away somebody's right to own a gun, but to be able to get it to where it's not so accessible. That might be handing it off to another family member for a temporary period of time. It may be, increasing other elements of safety around firearm storage. If somebody has stockpiled pills, that would be a good time to remove the stockpile and even have somebody maybe in a household that might be able to help to be able to administer when there are medications that are important to be taken. Some other ways to help a friend is really to be able to practice active listening. I know it seems really scary to think about asking somebody if they're thinking about suicide and asking, how do you respond to somebody when they're very, very emotional and upset? And it may make you scared, it might make you nervous or confused, and you might be afraid that you'll say the wrong thing, and that might lead you to not saying anything at all. Most of the time, the biggest thing that you need to be doing is just to listen, because when you listen, then you can really take in and maybe hear where the pain's coming from, hear what they feel is this insurmountable problem that they can't figure out how to solve. So it's okay to not talk a lot and just sort of take in a lot of that. Acknowledge the speaker. Let them know that you're listening actively, but you might nod your head, You might say, yeah, I hear you. Let them know that you really are paying attention to what they're talking about. Responding verbally, you may ask them questions or just say, help me understand that a little better. Just help me clarify what you're saying. Is this what you mean? And again, that's not telling them what they should be thinking or feeling, but letting them know again that you're listening and you feel their pain. And that can begin to take some pressure off of someone who is in that extreme pain. And then summarize what you hear. You know, here's what I think I heard you say, and I feel that what you're trying to tell me is that you're in a lot of pain because of such and such situation, and it just seems like everything's going wrong for you right now. Is that what you're telling me? Again, you're emphasizing how you really want to be listening and really want to be taking in what they're saying and that you're getting it. Keep that eye contact. All the same things. You don't want to act like you're distracted. Probably not a good time to bring the iPhone out at that point in time, because if they feel like you're distracted, then they're not going to be as honest with you, or they're not going to feel like you really are going to be able to be willing to help them get help. And then take care of yourself. When we do things like this to intervene, it can be take an emotional toll on us as well as those that are suffering on the other side, but it can also be difficult on our side. So make sure that if you have a friend or family member that you've been talking with about this, make sure that you have supports in place to take care of yourself. There are also some agencies that can help. You can always call the National Suicide Prevention Lifeline, which is 1-800-273-TALK. That's 8255. And there's actually a chat line as well, so you can go to the suicidepreventionlifeline.org, and they have a crisis chat, because a lot of people may feel, especially younger people, may feel more comfortable actually in a chatting environment than they might actually talking on the phone. And we do have, I think, one location in Kentucky, one of our regions, that actually put in a chat line that's tied into the National Suicide Prevention Lifeline, which they marketed out to their schools, and it's been very useful and helpful in that area. We're hoping maybe we can expand those in the future. There's also your community crisis line contact information for your community mental health centers and for other types of crisis services in your area. And if you can go to, I won't read out the web address here, but if you could go to that link, and that will take you to a page that will give you a listing of the crisis numbers from your region. Encourage a friend to seek help and support, and even maybe volunteer to offer to accompany them. One of the things that I often say in training, think about a time when you had to call an insurance company to find out what your health insurance might cover for something. And think about how enjoyable and fun that experience is. It's not really very fun. It can be very frustrating. And for someone who is in a crisis, it may be more than they can handle on their own at that particular point in time. So things that you can do to help connect somebody with services that can keep them safe can be really important. And then you may talk about safety planning or crisis coping plan resources. We'll talk.
Sorry to interrupt you. A question has come in about how much legally, how much can you actually do as a public library?
As a public library.
So I guess, would there be, I was thinking like, particularly when it comes to youth, if they approach you with, I'm thinking about this, possibly suicide, like what would your line be? Would it be okay to contact a parent or a family member? Maybe Jan would have a more specific example, but that was something that popped into my mind when she said that.
I think it would be good to talk to that person, that youth, and maybe find out ways that you can connect. First, consider is there somebody that they feel safe with? Um, if there might be a particular situation where there is some abuse going on, that you know that's sort of a balance, because if you hear about abuse or something like that, that is something that must be reported. But trying to find a way to lead that person to let you call or contact family member, or another thing could be if they are actually that you had the opportunity to contact their school if you didn't feel comfortable directly contacting that family. Talking a little bit about safety planning. And here are some of the things to think about. While in the ideal situation, someone would be working with a counselor or therapist to create a safety plan. A safety plan is not a safety contract. Used to be clinical services would make someone sign a safety contract saying that they would not kill themselves. And it's been found that those are not effective. It's not considered good practice. It doesn't protect someone from dying by suicide, and it doesn't protect an organization from being sued over a suicide death. But having a safety plan that is developed with that person in crisis, who can say, what are some of the things that I've done before that have helped me when I've had these feelings. So even being able to recognize personally, somebody recognizing their own warning signs. If they know in the past that they start getting really, really agitated as they move towards thinking about suicidal thoughts, those could be their warning signs. So what are their particular warning signs? What are some things that they've done in the past? Have they gone to take a walk? Have they taken a bubble bath? Have they read a book? Listened to certain types of music that are comforting? Just thinking about and writing down those things that have helped in the past. Who else can you reach out to? Who's been part of your social network that can offer support, or even just sort of a little bit of a distraction during this time period, and so, until you get to a point that you're calmer and feel better and maybe can see some other options. The other piece of safety planning would be contacting a mental health professional or an agency. It might be that you have the National Suicide Prevention Lifeline number written down as part of your safety plan. It might be that if you have a therapist or counselor, you have that phone number, and always keeping this whole list of things that you've done in the past or things that you might do as you walk through the safety plan. And this is the way a safety plan is meant to be. You start at step one. You start at that point where you're trying to use your own coping capabilities and with things that have worked in the past. And then if that doesn't work, you may be reaching out to family member or friend. And if that doesn't work, if all of these and above don't work, then you may be going to contact that therapist or counselor, or calling the National Suicide Prevention Lifeline. And the reason for all of that is helping to build up those coping skills, because ultimately, with help, even with therapeutic help, with counseling help, the idea is to help people gain their own ability to help themselves in some way. But in the meantime, knowing that you have these strong resources with you that are able to help you if you aren't at that point. There are even some safety planning apps that are available on for iPhones or any of your other types of phones like that. One of them is called My3, and on there you actually are inputting the pictures and names of people that you would contact if you were in a crisis. And there are some other tools that are part of it. Another one is the virtual hope box, and that too has places that you can put your safety planning in. You can put things in there that have worked for you in the past. There are also even some little, mind puzzle type games in it. Some relaxation tools. some inspiration tools and other types of things for coping. And then it also allows you to connect back with the National Suicide Prevention Lifeline. Another way that we see suicidal communication is in social media. And it's very, very important that when we see something that we're concerned about, that we can take some action on it. Somebody may write about how they want to die, or they might want to kill themselves. They might put it on Facebook or Tumblr or MySpace. Um, they might text it or tweet it, or whatever especially whatever our youth are doing now, that they, as the social media changes, these are all places that they may be able to communicate these things, communicate that they're feeling trapped or they're feeling hopeless. The good thing is many of our social medias are now beginning to have reporting mechanisms built into them, so that you can actually report something that you're concerned about that connects with the National Suicide Prevention Lifeline. So someone could actually reach out to that person and try to connect them with those with what the Suicide Prevention Lifeline offers. So if you're a person that you yourself have had suicidal thoughts, here are some things to think about doing, or some things that you can help your friend or family member with if they are going through a very difficult time. Creating a circle of trust. Who are those people that you feel that you can trust, that you can reach out to, make sure that they know that you've identified them as someone that you can reach out to when you're in crisis. Definitely anything that you can do to help maintain a healthy and positive outlook can be beneficial. That may be, for some, that may come with a social group, it may come with their faith community, whatever actually works for you as an individual. If you're struggling with having that healthy and positive outlook, then that may be an opportunity to reach out for counseling or therapy if you're not already in it, and to help work on those skills, because those are actually a skill that people can learn to increase that positive outlook. Strengthen your communication skills. You may be trying to communicate with someone that you're in such deep pain, and maybe you're not feeling like they're hearing. So finding ways to be able to maybe strengthen those skills can be beneficial. It's really easy when you're in crisis, or when you're in a lot of pain, to just sort of close down your mind and not really believe that there's anybody around you that can help, that wants to help. But being able to, whether it be getting help through therapy or getting help through an organization, to be able to help with that open mind, any of those things again can help keep you safer. Being able to let people know that you appreciate them, that you appreciate that they've been there for you, that you can call them, in 2 in the morning, or they've come and stayed with you. So letting them know just how much that you appreciate that. And really looking at how do you expand your world. It's so easy when we're in pain to isolate, to push away, to want to close our world into just one. But finding ways to be able to push out, even doing things like volunteering, to work with others that have a need or in crisis or whatever that can be. Being able to be a volunteer, and helps us as individuals feel as if there's a reason for us to be here, that even through our pain, maybe we can make a difference in someone else's life. And so that's something to consider doing. Even the military has now started pushing towards that in ways of helping those who are either active duty or veterans that have gone through suicidal crisis, finding ways to connect them up to where they're actually providing help to other people. And it has a dramatically positive impact on our view of the world. Um, And then we talked about the safety planning and expanding your social networks. All of those things can really make a big difference. The Living Works out of Canada is an organization that looks at various types of suicide prevention training, the gatekeeper type training. They do a program called Assist, which is applied skills and intervention training. And these types of programs can be very beneficial in helping us all become more comfortable with working with someone that might be suicidal in our family or friends. But more recently, they put together this designation that they call suicide safer communities. And by that, they mean looking at an individual community to say what is in place that can actually, as a community, what is in place that can actually lower the suicide death rate in those communities. And they advocate putting a steering committee together, really looking at the background of what's been done in a particular community, doing some suicide prevention awareness so that your citizens in that community understand suicide risk and understand who's at risk and understand ways that they may be able to help, looking at what in your community, what type of mental health and wellness promotion is in place. Training like this training, or like the Assist training, or QPR, which it stands for Question, Persuade, Refer, which is similar to what we're talking about now, but a little more intensive in that area. And that type of program can be helpful in increasing awareness while also giving people more tools and to be able to help somebody in crisis. Looking at clinical services, what's in place to intervene in suicide? What's in place in our clinical and support services? Are the folks who provide clinical and support services and intervention services, are they trained in suicide prevention? Are they trained in screening and assessment and treatment and management of suicidality? Because for many, many years, it was not a requirement for behavioral health professionals to have any suicide prevention training. And so I guess 2 years ago, our legislator passed a law that now requires behavioral health professionals to have 6 hours of suicide assessment, treatment, and management training every 6 years. And so there are programs out there to help in those clinical support services. What's in place for suicide bereavement? What's in place if somebody has a suicide loss that can maybe help them survive this loss, help them get through, and maybe reduce the opportunity that another death might happen? And see, we've got a question. We don't have, it says, is there a state site that gives the percentage of deaths per county that are from suicide? We don't have those full statistics posted because there are some regulations that don't allow, if there are 5 or less deaths in a particular county, that don't allow that to be publicized. The thinking is that would allow somebody to identify, maybe look in their community and say, oh, this was a suicide death, even though a family's not saying it. That can be a difficulty too, though, because that means that we have less chance of doing postvention, doing those things that can help to reduce risk when we can't fully identify. But we can, if there are particular counties that you want, we can work with vital statistics and looking at what they're willing to release. Sometimes rather than releasing just a 1 year, they might put, maybe they put 2012, 13, 14, 15 together so that the number is higher and gets over that 5 mark. Evaluation measures are critical in suicide care safer communities. Being able to measure where are suicide deaths occurring, were people in treatment for behavioral health disorders at the time of their death, or how do we know how to get better? How do we know how to do a better job in suicide prevention unless we put certain types of evaluation measures in place? And then if we think we're doing something that's working, having that evaluation measure in place will let us find out, are we really doing something that's working? And developing the capacity, looking in a community, if you're going to build a community support to prevent suicide, then that's not going to happen with just one person. You might have one person that's a champion, but who else are you going to need at the table? Being able to pull together, maybe it's putting in place a suicide prevention coalition, or partnering maybe with a substance abuse prevention coalition or something else that's already there. Being able to maybe go to your county judge executives, or going to your mayors and saying, who can you give us to be part of this so that we can look at making our community a safer community. That will also help to increase the chance that your efforts are sustainable, because over time, if just one person is trying to make a difference in a community and not involving others and not building that capacity, there's going to come a time when that one single person gets burned out. And when you get burned out, if you haven't spread it to others in your community, then when you're ready to get out of the way, maybe nobody else will pick it up. Excuse me. Another effort that we've been involved in from the state and nationally is called the Zero Suicide Initiative. And this has been a really exciting opportunity to be involved in this initiative. It basically looks at what they call a system of care approach for health and behavioral health care systems, and really having tools and strategies to where those who are involved in health and behavioral health can work together, looking at putting training in place, putting training not just for clinical professionals, but also for maybe the folks that are working in the emergency department. Maybe your upfront person that's taking the calls in your organization, looking at giving some sort of suicide prevention training, the appropriate level of training to everyone in a particular community. Setting a goal of zero. While that's a very audacious goal, we know if we don't set the goal at zero, where do we set it? Do we set it as, well, one is okay, 5 is okay? And we know if we look at, look at a hospital that is trying to reduce, say, patient falls or medication errors or things like that, they have to set that goal of zero and look at everything has to go into place to meet that goal and to reduce that risk. Zero suicide also is about continuity of care and follow-up. How do you know if somebody goes to an emergency department after a suicide attempt, and maybe they are supposed to connect with a therapist or counselor or an agency afterwards? How do you know whether they did? Because this is a time period that can be a high risk. And so if somebody's coming out of care in one organization and supposed to be going into care in another organization, and nobody is watching to see that actually happens, then that's where a death can occur. So the sooner that connections can be made, leap from one organization to another, or even sometimes within one single organization, maybe from one level of care to another level of care, being able to make sure that we have that continuity of care, that handoff, rather than the hot potato approach of your problem now. We have to find ways to work together. There are now therapeutic frameworks for working with a client that's suicidal. There are now programs that specifically are for treatment of that suicidality. And so making sure that our health and our behavioral health care organizations and folks are aware of those, are making use of these new tools. The really exciting thing about the Zero Suicide Initiative is that organizations that have taken this on have been able to dramatically reduce their suicide death rates, even among their highest at-risk clients, and bring that level of those that are at highest risk down to about that of the general population. And this has, to me, been one of the most exciting things in my 13 years in suicide prevention, to see that this is actually working in organizations around the nation. And so it's something that we're piloting here in Kentucky in a specific area, and as that pilot grows, we're hoping to push that out farther. So if you've got some questions, feel free to type them in now. Also, if you have heard anything that you feel like you want to know more about, you can also visit these websites. The Suicide Prevention Lifeline.org is the National Suicide Prevention Lifeline, the 1-800-273-TALK and the chat line that I mentioned. The American Association of Suicidology is a good organization to connect with if you want to know more about what's going on. They actually publish the state-by-state comparisons of the rankings of what state is higher than another one, as we were in the having the 18th highest rate. The zerosuicide.com, that's where you can go to get the information and all the tools and the toolboxes that they have available. The Suicide Prevention Resource Center, it has a tremendous library around almost anything to do with the prevention of suicide, and the American Foundation for Suicide Prevention is another organization that you can reach out to. There are several chapters of the American Foundation for Suicide Prevention in Kentucky. You've got my phone number here, my email address. If you're interested in some of the community trainings, interested in starting a coalition, if there isn't one in your community, if you know of folks that are in need of the meeting the new mandate requiring behavioral health professionals to get the 6 hours of suicide assessment, treatment, and management training, we can help get that in place. We've got some grant funds right now that we've been doing that around the state. Schools, we do a lot of outreach to our middle schools and high schools. We can provide evidence-based programs that can be used with students, the programs that have been shown to be safe and effective. And we can also help with the training that school professionals are also mandated to get every year. We've got various different resources for all of those. That, or if you want to find out about starting a survivor of suicide loss group in your area, that we always say that post-prevention is suicide prevention. You can give me a call or contact me by my email for any of these things, or for any other technical assistance around suicide prevention efforts.
And so you would provide training that would be appropriate for teenagers or for youth as well?
We really prefer to use evidence-based programs. Mm-hmm. Again, those programs that have been shown to be safe and effective, mm-hmm. and actually sort of talk the talk in a youth language. Okay. And so there are programs that one particular is called Lifeline. It's not related to the Suicide Prevention Lifeline, but it's called Lifelines, and it actually shows youth themselves working through recognizing warning signs and how to talk to a friend, and it shows various different scenarios that they might find themselves in, and how to work around them. And it emphasizes help seeking for others, but at the same time, that's also emphasizing help seeking for self, making it okay to seek help, and opening the door to having a conversation about um, who would we go to, and making sure that youth know that the best thing that they can do is to help connect their friend with a trusted adult, not to try to take this on by their own, not to keep that secret, but how do you connect up with help to help keep your friend alive. There are other school-based programs that we are just starting to work with a program called Sources of Strength, and it's really a little bit different than maybe the lifelines. It's more about um, being able to improve resiliency, connectedness, training peers of various different groups within a school. Usually, it's done in a school, to be able to create positive messaging, to have to be able to make it okay to reach out and ask for help, sort of change the environment. And while it's evidence based for preventing suicide, it also can help with issues of bullying, substance use, and other areas of issues that we look at with our teams.
Have you heard of this?
I'm not sure about the 741-741. Can you tell me a little bit more about that? I know there are more and more chat and texting sites coming up where they're actually connecting in ways with the National Suicide Prevention Lifeline, and I do think that if you've got a positive site that connects you with somebody that knows what they're doing and can help somebody get into help, I do think that the texting and the chats are very, very good options. And what I'll tell you, what I can do is I can go back and look to see if they are connected, in fact, with the National Suicide Prevention Lifeline. Because the way that the Lifeline, National Suicide Prevention Lifeline phone services work is you call a single number, but it will route to the closest certified crisis line in a particular area. And so those are some of the things that they're doing, again, with the chat too. And that gives the opportunity to make sure that the people on the other end for the crisis line are very, very well trained, that they know what the resources in the community are, that they can tell somebody how to get help for themselves and how to get help for a friend. And so that would be the same thing that we would want. We would want some, like you said, very, very well, people that are very trained in answering these type of messages, and also know how to tie someone back into community resources, or be able to send resources if there's an immediate emergency, to have things put in place for that. But I will check on the 741-741.
I kind of looked at their website and didn't say anything obvious about being partnered with any of those organizations, but that's just from looking at it for.
I can dig into that a little bit deeper.
That'd be great. I'm going to go ahead and change the screen real quick to allow everybody a chance to download these slides if you'd like to. Let me change that last slide that have the instructions on how to do that there. So, and we can go ahead and continue to take questions if you all have any more. Otherwise, I'm sure Jan's happy to have you contact her.
Absolutely.
Email, we have her email and phone there on that final slide. So with any follow-up questions, anything you think, and if you'd like to, I can let you send out an email to the class about that 741,
okay, yes,
741.
I can do that.
If you find out some information on it. So otherwise, if any more questions, we'll hang out for a few more minutes and see if any more questions come in. Otherwise, whenever you're ready to exit, you can click that X in the top right-hand corner. Jane, you have more you want to add? Go ahead, please.
Just one thing. Sorry. There's for faith communities, there's a new resources come out, and I should have put it on the slides, but I can maybe get that out to everybody. we're looking more and more at how faith communities can get involved in suicide prevention.
Mhm.
And there is the National Action Alliance for Suicide Prevention has put together this toolbox basically online that really helps people that are in faith communities be able to spread the message, increase connectedness, reduce stigma to accessing care. There are sermon notes written into it for various different faith communities, looking at what they're challenging faith communities to do is to designate 1 week out of the year where they make it a priority to talk about how faith communities can reduce suicide. And so we're hoping to see this catch on in Kentucky. We've got some faith communities that have said that they're really, really interested in getting involved in this, and which would be another way of really adding, really spreading our capacity to being able to reach folks that can help make a difference and being able to reduce that stigma that keeps us from seeking help sometimes.
That's a great addition to the resources that you've already listed. So, I mean, we can get that info about that in that
Yes,
email as
absolutely.
well. Sure.
Yes.
Yep.
We'll send out the info about the faith community online.
Absolutely. Well, thank you all very much for being here today. I'll be sending out, as it says there, a certificate of attendance and a link to a survey about this class. So we'll appreciate your input on that. And look for another email from us with that, as well as some follow-up information from Jan. So thank you all very much for being here today.
Yes,
thank
thank
you,
you.
Jan, for taking time and coming to do this for us. We really appreciate it. So, as I said, y'all can click the X in the top right-hand corner when you're ready to exit. Have a great afternoon, everybody. Thank you.
Thanks.